So, good morning, all of you. Now, I'm Shubham Purana, Faculty of Medical Lab Technology from Galgotia University School of Medical and Allied Sciences. And the course code we are discussing is BMLS3002, and the course name is Basics of Hematology and Hematological Diseases. So, today, now we are going to discuss about the classification of anemia. The topic for this thing which we are going to discuss is the classification of anemia. Now the prerequisite or the recapitulations means what are the prerequisite and recapitulations for this topic. Anemia, what does anemia means? Anemia, N means absent or without, anemia means blood. So without blood means a decrease in the count of RBCs, means when the levels of RBCs, that is red blood cells, they go to a very decreased level, due to which the hemoglobin that is present inside those red blood cells, that is responsible for low hemoglobin levels, and which will result in the low transfer of oxygen, because hemoglobin is responsible for transportation of gases, that is mainly transportation of oxygen in our body. So this anemia, anemic condition, it will result in the decreased count of RBCs, that will further result in the decreased count of hemoglobin, and it will also further result in the decreased transportation of oxygen gas. So what are the objectives we are dealing with? Means the objectives that how we are going to deal with this topic. In this objectives, we are going to deal with the definition of the anemia and the classification of the anemia. Means what is the actual meaning of anemia and how it is classified into how many types. Now here we are going to discuss about the introduction of the anemia. What actual anemia is. So anemia is a major killer in India. Means this disease, it is responsible for very high deaths in our country, India. According statistics reveal that every second Indian woman is anemic. According to the researches done, and according to the details, according to the stats, means according to the studies that we have done, every second India woman is anemic. Means every alternate, or we can say every second woman in India, she is having anemia or she is suffering from anemia. One in every five maternal deaths is directly due to anemia. Means the ladies that are pregnant who are going to give birth to the baby, in this, one in every five, means out of those five female individuals, one death is majorly due to this anemia. So we can analyze how much life-threatening disease is this. Anemia affects both adults and children of both sexes. Means anemia is responsible for affecting children also, and it may affect adults and children of both sexes, means both male and male. Although pregnant women and adolescent girls are most susceptible and most affected by the disease, but it also specifies that although pregnant women and adolescent girls, they are most susceptible to this disease, and they are mostly affected by this disease, anemia. Now moving forward to the classification of anemia. This classification of anemia, as discussed here, see, we are discussing about the classification of anemia. This classification of anemia, it is majorly on the basis of cause and on the basis of morphology. So, dividing these two things, we can say the classification of anemia is first one, it is the etiological classification. Means anything that is on the basis of cause, anything that is on the basis of the cause or origin, that is known as etiological classification. So we can say it too as etiological classification. Now moving on forward, this is the morphological classification. Okay, now according to these things, they are further divided into majorly these types. Now on the basis of cause, it is divided. First one is the blood loss, second one is the inadequate production of normal blood cells, third one is the excessive destruction of blood cells. Means what we can say is anemia is that condition in which there is a very high loss of blood in the body. Okay, second thing, it has mentioned on the basis of cause, that is etiological classification, inadequate production of normal blood cells. Means the red blood cells, they are not produced adequately in the body. There is inadequate production of these normal blood cells, due to which anyhow it will be affecting our blood levels. Now, excessive destruction of the blood cells. The third thing is means all those blood cells which are exact in values, these blood cells they are excessively destructed. These excessive destruction of blood cells takes. Now, on the basis of this morphological classification, the anemia is divided into normocytic, microcytic, and macrocytic anemia. Now, on the basis of cause, means on the basis of etiological disorders, this is anemia is majorly divided into these categories. Now, based on clinical features. First of all, due to the iron deficiency, first of all, the anemia that is divided, it is due to the iron deficiency anemia. Second one is the megaloblastic anemia. Third is the pernicious anemia. Fourth is hemorrhagic anemia, and fifth is hemolytic anemia. This hemolytic anemia, it is now majorly divided into two types. That is thalassaemic anemia and sickle cell anemia. Means the basis of cause in which the RBC's color and shape and all these things change. Like in sickle cell anemia, it goes like in sickle shape, and aplastic anemia is also a type of this anemia. Now discussing on forward on the basis of morphology, we are going to discuss about the different types of anemia. So the different types of anemia on the basis of morphology are normochromic, normocytic anemia. Means they will be usually dependent upon the MCHC and MCV. Means what is MCHC and what is MCV? It is the levels, the mean corpuscular hematocrit means the RBC cell count, and MCHC mean corpuscular hemoglobin concentration, the concentration of hemoglobin. So this includes anemia of chronic diseases, means anemia which lasts for a very long time in the body, chronic, that is called anemia of chronic disease. Now hemolytic anemia, those which are characterized by the accelerated destruction of RBCs. Means hemolytic anemia is that type of anemia in which the RBCs they are going to be destructed at a very high rate in our body. Anemia of acute hemorrhage, due to acute hemorrhage in our body, if any anemia is caused, that is anemia of acute hemorrhage. Aplastic anemia, this anemia, it is characterized by the disappearance of RBC precursors from the bone marrow. Means the formation of these red blood cells is usually takes from the from the bone marrow. So it is characterized, this aplastic anemia, it is characterized by the disappearance of RBC precursors. Means all those precursors which are responsible for the formation of these RBCs from the bone marrow, they will be completely getting disappeared. Moving on forward, we have hypochromic and microcytic anemia. In this condition, what happens is there is low level of MCHC and low MCV. Why are these things so? Because it includes iron deficiency anemia, thalassemia, and anemia of chronic diseases. Means under this hypochromic and microcytic anemia, it includes iron deficient anemia. Anemia is usually deficiency of iron, so it includes iron deficient anemia, all those red blood cells which will be deficient with the hemoglobin, and it will further be responsible for the low iron levels. This anemia will be considered under this. Thalassemia, which is also a type of anemia, it will also be considered under this. And anemia of chronic diseases, anemia which is due to the chronic diseases which are prolonged in our body, which are responsible for this development. Now normochromic and macrocytic anemia, in which normal MCHC and high MCV, means they are usually due to vitamin B12 deficiency. Vitamin B12 deficiency is mainly considered here, and folic acid deficiency, that is vitamin B9. Now we are going to discuss the treatment for iron deficiency. So the treatment, how we can treat this iron deficiency in body. It consists of elemental iron food divided up into 3 times daily. Means we should take a diet which is consisting of iron, that is 4 to 6 mg. It is already mentioned here, 4 to 6 mg per kg per 24 hours divided into 2 to 3 times. Means the appropriate concentration should be 4 to 6 mg per kg per 24 hours. Means the diet that we are taking, in that diet per kg diet, there should be 4 to 6 mg of iron concentration which we should be taking within 24 hours, and that should also be 2 to 3 times that within that 24 hours. Elemental iron is best absorbed with vitamin C. So the absorption of this elemental iron, it is mostly best with the vitamin C. Vitamin C is mostly present in citrus fruits. Now response to treatment should be verified within 1 to 2 weeks after initiation of iron. Means if we are taking this iron, So after taking intake of these irons, our body should respond against to that. Means the treatment, it should be workable. The levels of red blood cells or anemic condition should be low after 1 to 2 weeks as we are taking this iron. Limit cow's milk to 24 ounces per day or less. We should have a less intake of cow's milk, that is 24 ounces per day, or we should take it less. Now these are the references from which we have taken the materials regarding this anemia, that is nutritional anemia report of a WHO scientific group, World Health Organization. The serial number is mentioned. It is from PubMed and Google Scholar, and there are different publications from where we have taken about these references. That's all for this. Thank you all. This was for the topic anemia. Now we'll be discussing about in brief about the different types of anemia. This was all about the classification of anemia.